All right, welcome back, everybody. We are delighted right now. We have Dr. Crutchfield from Crutchfield Dermatology with us. Hi, Dr. Crutchfield.
Hey, how you doing?
We're good. How are you today?
Good. I've been working hard all day, and I haven't been out, but everybody says it's great out.
Oh, it's beautiful.
beautiful.
Well, we saw this headline in the paper. Maybe you saw it today. Botox lifts the next breast thing. About how this woman dermatologist...
Sure, Wexler.
Yes.
Wexler, she's like claims she's the dermatologist to the stars.
Yeah, they all do that. But anyway, she's well known, and I've heard about this for a couple of years.
Well, tell everyone what it is.
Well, it is, they're actually using Botox, and what happens is normally you have two muscles that oppose each other. And one muscle will pull one way and one muscle will pull the other way.
On your breasts?
Yes,
okay.
A lot of places. And like, for example, if you bring your arm up, that's flexing one muscle. Or if you straighten your arm out, that's flexing another one. And so a lot of times they'll oppose each other.
Okay.
Oftentimes, and that's what will happen sometimes when you're using Botox on the face. You have some muscles that will pull your eyebrows down and others that kind of pull it up, and they keep themselves in kind of a natural balance. But if you relax one, then the other one that pulls in that direction takes over. So that's why sometimes if you do Botox near the eyebrows, you can get an eyebrow lift, because you relax the ones that are depressing the eyebrows, and the ones that normally raise it kick in and they raise it up a little bit. So it's kind of the same theory that they're using with the breast lift. And what happens is there's a muscle group in the front of the chest called the pectoralis minor muscles, and it's kind of the major ones are the normal chest muscles that you see in bodybuilders and things like that.
Right.
Well, there's ones that are right underneath it or close to it that are called the minor ones, and if you can actually relax those, there's muscles actually in your back, central back, called rhomboidalis muscles that will pull up on the chest. So if you relax the ones in the front, the ones in the back that cause the breast to lift will lift up a little bit. So you actually do get a lift in many of the cases.
Okay, but
so would they put the Botox in your back?
Nope, you put it in the front, in the muscles in the front, and the chest muscles.
But isn't this controversial?
Oh, it's very controversial, but for several reasons. The main reason, it doesn't always work, and in fact, I talked to a colleague who did a lot of it in Canada, and he said, some of the patients are very happy, but some are not as happy, and it probably works about 50 to 60% of the time to some degree. But you're doing a procedure that doesn't work almost half the time. That's not a lot of fun either. Plus, it's a little bit painful.
Right. And do you just shoot the Botox right into the breast?
You actually do into the muscle.
Okay.
Underlying the breast or around the breast.
Oh, for crying out! That sounds painful. But
what is the FDA saying about this?
Well, once again, it's really interesting because in the article that you guys that sent me a link to, I read it, and they said the plastic surgeons said they absolutely will never do FDA approval. We won't use it on that. It's definitely not FDA approved for the treatment of the condition. But we use Botox a lot of times in areas that are not FDA approved. In fact, if you do smile lines, crow's feet, that's not FDA approved, but they don't mention that. So the medicine itself is approved to be used anywhere, but it's specifically indicated, Botox, for frown lines between the eyebrows, and also another one that we use, hyperhidrosis, so people that perspire under the arms. That's huge. I mean, you guys are wheelers and dealers, and you go out to all the different the shows. Well, a lot of people, when they're walking the red carpet, they don't want to raise up their arms and have a big perspiration stain underneath. So a lot of people will use Botox under the arms to diminish perspiration. A lot of politicians do it. When they roll up their blue shirts and they're out waving, they don't want to have a big perspiration stain. That doesn't look great on the cover of Newsweek or Time.
No, it doesn't.
So a lot of that's one thing, and it's actually FDA approved to treat that. And some people have a real problem with perspiration, and to the point where it's not funny. It's a life-changing problem. And so we use a lot there, and it works great.
No, I remember one time Julie and I were just kind of half kidding about, the excessive sweating, and we got an email from a woman who said, all my life I've worn black because of it, and it's been such a thrill that I can go and do Botox under my arms, and I can wear light, and I can wear color. And
for many patients, it's life-changing, because for people that don't have that concern, you don't think about it too much. But for people that do, every day when you get up, that's what dominates your clothes selection, what you shop for, everything.
So do you see, our dermatologists or plastic surgeons, do you see very many people doing the Botox in the boobs for the Cooper's droop?
No, I don't see a lot. I don't. And I was actually trained on it a couple of years ago.
You were? Okay.
Yeah, I trained, but because the results were iffy and it's a little bit painful, and once again, I can certainly use a medication that's not FDA approved in the same area versus, like you're talking about the glabella or the side. But when you're starting to move down on the chest, and you have to use higher volumes too. And the one thing that has come on, we discussed this a few weeks ago, when you're using higher volumes of Botox, there is a theoretical risk that it could travel and go to other areas and can cause problems. So.
Yeah, that's what this one doctor said. He said this is just a complete gimmick because if the Botox travels, you're not going to be able to roll over in bed or...
Well, right, that was...
But I would say in Dr. Wexler's defense, she's a recognized dermatologist. She does a good job. And sometimes when you're really skilled, you can develop something that you're very good at, but it's difficult to achieve that level of accuracy, so it's difficult for other people to repeat it, too.
Oh, okay.
All right, now I want to ask you, Dr. Crutchfield, because this is the number one thing that I get asked if we're just like out and about.
As we were yesterday.
Is the lips.
Yes.
And I feel like Meg Ryan has done more bad.
And Melanie Griffith.
And Melanie Griffith. They've been just the worst poster children for getting rid of lip wrinkles by having this overly inflated lip. So talk to us about what you do.
My approach when I'm doing any type of cosmetic treatment, I want it, number one, to look natural. I don't want anybody to really know what you've had done. And I think less is more, and I want people to look great for their age, but not younger than their age or different than their age. And sometimes if you push a cosmetic treatment too hard, for example, and I like her, I'm not trying to pick on her, but Joan Rivers. The reason I bring up, I'm not sure how old she is. She's probably in her 70s, maybe older, but she doesn't look like she's 75, but she doesn't look normal either. So she looks younger than she is, but it's not quite right.
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 So I like to do things where it looks natural. I want your friends to be enviously confused. When they look at you, they should say, "Oh,
you lost weight.
She looks great," but I don't know what she did.
But people always ask, they're like, I've got all these kind of, I feel like my lips are kind of sinking, or I've got these wrinkles, but I don't want to have that. And I always say, well,
the interesting thing about the lips is a lot of people come in. I've seen 3 patients today, and they said, I've got these lines on my lips, and I don't smoke. I've never smoked. Because a lot of people call it smoker's lines, but it's more genetic. It really doesn't have anything to do with smoking. And another thing is when you look at pictures of people, if you gave 2 different pictures, which one is older? And then you say, this one's older, and you ask why. People can't really say why, but subconsciously, part of it is you recognize the loss of volume in the lower third of your face, especially on your lips and around your mouth. And by restoring that naturally and gently, you can make people look younger, but they don't look funny. And so that's really my approach. I just use a little bit just to restore the way they used to look, not to make it over-augment, to make it look silly.
That's where we lose it, huh? The bottom third of our face.
Bottom third of the face, over time, you tend to lose a little bit more volume. In fact, when you're younger, and this is really a neat analogy, when you're younger, your face is in the shape of a triangle with the point at the bottom. So your upper cheekbones and then your chin is the lower part of the triangle. But over time, that triangle flips around where the lower 2 points of the triangle are kind of down where the jowls are. And so what you do is you want to flip that triangle back up again.
Oh, my gosh.
Well, that is true, because you always think, you've
lips
got
get sunken in.
Well, you've got
That's
cheeks
right.
when you're younger.
That's what happens.
Oh, Dr. Crutchfield, thank you so much.
Well, it's always fun chatting with you guys, and I wish everybody a great day and a great weekend.
Yes, and you can get a hold of Dr. Crutchfield at CrutchfieldDermatology.com. We'll be right back.
More Lori and Julia coming up. FM 107.1, living the life out loud.